Hi friends, so let's see a few questions today. Okay, here the first scenario is a 58-year-old man with a head and neck cancer, and his cancer is in progress, so it's advancing. He is telling the nurse that he do want parenteral therapy. So nurse explained this client that you can write an advance directive. So where you can find this information? Okay, clients with this type of information can be found in which of the following? So we have about 4 choices. You can see this one information in Patient Self-Determination Act, or Nursing Scope and Standard of Practice, or the Patient Protection and Affordable Care Act, and the Patient Rights of Bill. Patient's Bill of Rights. Okay, so out of this, so you can easily eliminate few by seeing the name itself. Nursing Scope of Practice, this is something related to the nursing. So then the Patient's Bill of Rights and Patient Protection and Affordable Care. So you have few confusing options here, but still the Self-Determination Act. So that word itself, it is explaining something is self-determination. Okay, so let's see, that is the correct option. In 1990, Patient Self-Determination Act was passed by the Congress to ensure that upon admission to hospital, long-term care facilities and home health agencies, patients are informed that they have the right to accept or refuse medical care. Okay, as well as to specify in advance through the advance directive what their wishes are. So this one is explaining, this is the option. Okay, not a nursing scope of standard of practice, then not a patient protection of affordable, and not patient's bills of right. Okay, so question number 2, a 14-year-old newly diagnosed. So there are certain things you have to really focus on the points. 14-year-old a teenager, and she is newly diagnosed, okay, with the diabetes, and she is preparing for discharge. Which of the following activity best describe the nurse role as a client advocate? So client has the nurses has a different role to play. Yeah, there's caregiver, there's a teacher, advocate, all those things. So many roles we have. So as a best patient advocate here, so options are arranging for a visit with a home health care nurse. Second option is providing written medication instructions to the client's parents. Third, instructing the client to follow up with the provider in 4 weeks. Fourth is teaching the client how to administer her own medication. So this is the correct option. It's the fourth one. Teaching the client how to administer her own medication is the best example of the nurse role as a client advocate. Okay, because this action directly helps the client to develop self-advocacy skill. Okay, so other stuff like instructing client to follow with her provider in 4 weeks may be important in the overall management of this client's care, but not directly assisting the client necessary skills to manage her own diabetes. So this is a patient self, she is learning, and self advocacy skill for the patient. Okay, so that's important. Other all important, like, but this teaching her is the first important skill for that patient. Next question is, client is seeing for an outpatient appointment. Obtain a copy of, so the patient is asking, he want a copy of his medical record. Okay, so where you can see this medical record, and this guaranteed by virtue of which of the following, where you can see this one. So Code of Ethics for Nurses, or HIPAA, it's a patient right patient health information, okay, in that record, or the Patient Self-Determination Act, or in Americans with Disability, where you can see this one. The correct option is HIPAA, protect the patient's right to review, copy and request amendments to his medical record. Okay, this is where you will see the patient right to get copy. The Code of Ethics for Nurses does not address this issue. The patient self-determination we already discussed about the advanced directive he can do, and the Americans with the disabilities, that is for the disabled Americans, information. So next question is, after receiving a report at the start of evening shift, so first you have 4 patients, which patient you will go and see first? Okay, so that's a question. So first one patient is suffering from hyperkalemia. Okay, hyperkalemia is a potential high risk situation. Next is a 21-year-old woman with a sickle cell anemia with a pain score of 6/10, and a 55-year ovarian cancer waiting to be discharged, and 72-year-old with a COPD with a pulse oximeter reading saturation is 96%. So who will you see first after you got your report? Whom you will go and see first? So of course the hyperkalemia patient. Okay, that is life-threatening situation. Hyperkalemia is a potentially serious condition that in a client undergoing treatment for a non-Hodgkin's lymphoma could indicate a tumor lysis syndrome. So this patient you should see first. Rest all can be seen later on after your number 2, 3, 4 in criteria. Next, a 34-year-old woman who developed Stevens-Jones syndrome while undergoing treatment with carbamazepine is being referred in stable condition from the intensive care unit to medical unit. There are 4 beds available, so these are the cases available in those unit, but with which patient this patient can share a room. So one is MRSA, the other one is diarrhea, third one is fever of unknown origin, and fourth one is atrial fibrillation. So this patient will have blister and peeled off skin and this. So potential risk, this patient is at risk for getting infection. So you can't place this patient with the patient who has MRSA, then diarrhea, and with fever of unknown origin. So the only client who can share room with this patient is atrial fibrillation. Okay, this is not an infectious process. So next question is, 72-year-old man who had a stroke is being transferred from a medical unit to a rehabilitation center. So step down, stay in place, nurse, case manager assisting for processing. So the nurse knows that the goal of case management include which of the following. So here you are the question is checking whether you know the goals of case management. So the case of goals are there are one of the primary goal of case management is to improve the coordination of care. That's true. That is one goal is coordination of care, improve coordination of care, and second is another primary goal of case management is to reduce fragmentation of care, means not in breaking. Okay, the reduce fragmentation of care. These are the 2 goals of case management. Other what is given is case referral, making referral to local organization, and managing help to make a discharge, and this is not a goal of case management. So helping for discharge or making a referral, these are not the goals. Okay, the goals are reducing the fragmentation of care and improve the coordination of care. These are the 2 goals. Okay. Next question is, 18-year-old client with acute lymphocytic leukemia is admitted to bone marrow transplantation unit. His family is having a trouble dealing with the emotional and financial pressure of his disease. The nurse, case manager, physician and a social worker meet to discuss the plan of care. The nurse knows that this type of interdisciplinary interaction is best referred to as which of the following. So interdisciplinary, okay, is a care. So this different professional people are meeting. So that's an interdisciplinary group. Their collaboration with the interdisciplinary group. So here there is different things happen. Collaboration, then there is although the healthcare may have been, then the operation, all those things takes place with the interdisciplinary. Which one is coming under the collaboration here? That is a question. Case management is referred as a coordination of care. Okay, so coordination of care is case management, not collaboration. Yeah, and reduce fragmentation and improvement quality of these are all under case management. The correct one is interdisciplinary interaction between different healthcare professions such as nursing, medicines and social worker is known as collaboration. So these are jointly their interactions between different professions, that is collaboration. Okay, case management, other stuff, that's case management. Although the healthcare team may have been cooperating or operating as a team, the term cooperation does not especially refer to concept of interdisciplinary action. So the term cooperation does not specifically refer to the concept of interdisciplinary action. Okay, although the healthcare team may have been operating in a collegial, cooperative and professional manners, this term does not specifically refer to the concept of interpersonal. So we have to be very specific about the terms used here. So the collaboration is the correct word here. Okay, not case management and not operating or cooperating, none of this. So collaboration is the right word here. The answer, next one is a 15 weeks pregnant scheduled for an amniocentesis. So 15 weeks and she is undergoing, and this patient says that the nurse realized that she didn't fully understand the risk and benefit associated with the procedure. So here the question is that, so what are the roles, what are the described nurse roles obtaining informed consent? So are you the one getting the informed consent? No. Nurses are not getting informed consent. Informed consent is taken by the person, whoever is doing the procedure, the physician. Informed consent will be taken by the OB who is doing the amniocentesis. So let's see, you also have some role. Nurses have some role in getting the informed consent. So what you do is you witness the signature and make sure that the patient understands. Okay, if the patient didn't fully understand the risk and benefit of amniocentesis, you have to ask your OB, the physician, to explain to her again and make her understand, to go to her down to her level and make her understand what procedure they are going to do. That is the two role for the nurses in case of getting informed consent. This physician it's physician's duty to provide information to the client related risk and benefit. Okay, so physician's duty to provide information to the client related to alternative. So risk, benefit, alternative, everything to be explained by the physician. You are going to witness the signature and provide the necessary information to make informed decision, ensuring she has been provided with enough information. That's it. So next question is nurse noticed an increase in the prevalence of pressure ulcer among clients in an intensive care unit. She documented her findings and worked with her manager to develop and implement a new policy using pressure ulcer risk assessment scale. Which of the following best describe the nurse action? So here also the category performance, improvement, quality, improvement. So here in performance improvement, quality, okay, quality improvement includes activities such as identifying opportunities and developing policies for improving the qualities of nursing practice, identifying and increasing pressure ulcers, and implementing a policy aimed at improving the assessment and prevention of first pressure ulcers best fits the definition of quality improvement. Okay, that is what it is. Here the nurse may be collaborated for work together with the colleagues, but this is not a best choice. Advocacy refers to the nurse's duty to act on behalf of a client. Although reducing pressure ulcer may indirectly advocate for the client, it is not the best answer of choice. Then case manager refers to the coordination of care to reduce fragmentation and cost and well as to improve the quality and outcome. Okay, so thanks for watching. I'll come again with another video soon. Okay, bye.